And as strict physical distancing and mask-wearing guidelines continue across Canada, some anti-mask groups are partnering up with anti-vaccine groups, and they're taking a page out of their misinformation playbook to relay their message to the public. I'm now joined by Maya Goldenberg. She's an associate professor of philosophy at the University of Guelph. Maya, thank you very much for your time today.
Oh, thank you. It's nice to be here.
Yeah, talk to us about these two groups of people. We know with regards to the anti-vaxxers and where that stand has. Now we've got our anti-maskers, and we've seen across the country and predominantly in Ontario, those holding events, protests, demonstrations saying they don't need to mask, everyone is safe.
Well, the similarities were pretty noticeable even before I knew that they were starting to collaborate. That was reported recently by the CBC that the anti-mask organizations who are fairly new, just because of the newness of the issue, are reaching out to anti-vaccine groups to sort of learn how to amplify the message and to get the media attention, like right now, the media attention that they need. So some similarities are such tactics as cherry picking the data. So they're reporting on research indicating that masks don't work, or maybe masks aren't very necessary. And that's consistent with vaccine groups, because human organisms are different enough that you're never going to get 100% in all things. That's why in biomedical research, we typically don't get too excited about the results from one study.
Right.
We like to look at multiple studies, right? So they'll pick the one or two that might give the message that they want, and then ignore the 98 or 99 studies that say otherwise. Other things are. Oh, yes.
No, well, go on. Tell me some of the other things there, because I was going to ask you sort of what is the concern around that as we're sitting in the middle of a pandemic, doing everything we possibly can. We know we can't say we're going to get eradicated. We need to have a vaccine, and I'll ask you about that in a minute. But what is the concern with that mentality being out there as we're trying to stop the spread?
Well, the concern is that we need a lot of, unified response, and we need everybody to be part of this. So things like social distancing only works if everyone does it. Same with masking. Things will go a lot smoother if everyone follows through doing their part to be part of this effort. These kind of messages, whether it's anti-vaccine or anti-mask, are a way of conveying that people don't trust the system. They don't think that the government is doing the things they need to do to respond to this crisis. And of course, this crisis is complex. There's lots of things to be critical of. Masking seems to be pretty solid in terms of the evidence in favor of it. But things like some people are unhappy that the economic downturn, some people think that is the consequences of that are going to be far worse than the virus itself. It's hard to gauge exactly that, because we're talking about different kinds of harms.
Right.
But what so when people take up an anti-masking cause, it is not always the case that they are convinced that masks don't work. What they might be doing is conveying a feeling that whatever the response is, it isn't working in the interests of the public as they see it.
Where does, and now, of course, we know this is being worked on around the world to get a vaccine for COVID-19. So that kind of brings in the anti-vaxxers into the conversation here. When we get a vaccine, what happens then? And where does that conversation or that debate go? But what about, coupled with that, the issue, and we've seen it in the United States as well, about freedom of choice? My constitutional rights, et cetera, saying you can't make me do something that I don't believe in or I don't feel is beneficial to me. Though, as we've all been saying here, if we all do this together, then collectively perhaps I can say we're defending our right to good health and to stay healthy and not to die from this, as some people sadly have.
I'd say it's always okay to ask questions, especially about a technology that hasn't even been invented yet. So whatever our science communications and our rollout of the future vaccine it's going to be, there has to be an allowance for some resistance and a lot of fear around the vaccine. That's true about childhood vaccines that have been around for decades and have a good track record. And it's certainly going to be true about a new vaccine that's never been used before and has been rushed to market. So there needs to be an allowance for that. As for the question about constitutional rights, the law is not the law is not on the side of people who are making this claim. Indeed, we have enacted public health measures in times of serious public health crises, like comparable to this one, where people can be forced to submit to these kinds of interventions in order to protect the public good. Now, we don't want to do that unless it's entirely necessary. We'd rather people come along willingly, but there could be a case that you could mandate vaccines in a crisis situation like a pandemic.
Yeah, like what we're seeing right now. It's a really
That's right.
a great conversation. It's certainly an important one, and I think one we'll continue to have as we navigate through this. Maya Goldenberg, Associate Professor of Philosophy at the University of Guelph. Great chatting with you, Maya. Thank you so much for this.
Thank you too.